Cross County Cardiology is a group of cardiologists, a nurse practitioner, a PA, a group of ancillary staff, including secretaries and nurses, who every day does their best to treat every patient the way we want to be treated. When a patient comes to see a cardiologist, they can come for a variety of reasons. They can come for chest pain, they come for shortness of breath, they come for swollen legs, they come for a fluttering in their chest, they can come because they passed out or they feel lightheaded, or they have high blood pressure or their cholesterol's high. So really what we try to do is during the initial evaluation, sit down and talk to somebody. We try to get all their records of doctors that they've seen in the past and review them. If we can get them before the patient comes to see us, that's great. If we can't, we review it while the person is in the room. And then we sit down and we decide, based upon the history, the physical, the symptoms, if anything needs to be done, such as further testing, or if medication needs to get adjusted. And we try to do that on the first visit. Patient care is a total patient experience. The patient has to feel comfortable when they come to the office. They have to be treated with respect. They have to feel that we know what's wrong with them and we're able to provide them with proper therapies and appropriate follow-up afterwards. About 3 years ago, we installed whiteboards in each of our examining rooms because a lot of physicians say that patients are non-compliant. They don't take their medications, they don't follow up. So when we thought about that, we thought maybe it's because we as physicians don't do a good job in explaining things to patients, because I can't imagine why anybody wouldn't want to get better. So we put whiteboards in each examining room and we spend the time to write out the diagnosis, write out the symptoms, the possible treatments, the possible tests, and we try to break it down so that we're sure when somebody leaves the examining room that they understand what's wrong with them and what they need to do. And this way, if a patient doesn't do what I ask them to do, then they're truly non-compliant. I want to make sure that I've given somebody a full experience so that they understand their potential risk is and how we can mitigate that risk. So a patient can expect to be treated with respect when they walk through the door. They can expect to be in a comfortable waiting room where once a patient gets past the waiting room, privacy is of the utmost importance to us. There'll be an experienced nurse or medical technician who will do the vital signs and do the basic interview, and then they will be seen by one of the physicians, which 99.99% of the time will be the physician they made the appointment with, barring any emergency, and they can expect to have the time spent with them where they'll feel comfortable with the visit.